Hi, I'm Rick Kaler. Thanks for joining me. The recent horrifying murder of UnitedHealthcare Group CEO Brian Thompson has called attention to the anger that many Americans feel about our healthcare system. This tragedy has thrust the very real issue of healthcare costs back into the headlines. One article on this topic from Ken Altucker for USA Today offered 7 reasons why Americans pay so much for health care with such poor results. When I saw the headline, I thought, finally, someone's going to bring up the elephant in the room, taxes. The 7 reasons included bloated administrative costs, lack of price transparency, overpaid specialists, higher prescription prices, and several more. But I didn't see a word about how, compared to other developed nations with cheaper health care, Americans pay far lower taxes. That omission feels like leaving a critical piece of the puzzle just off the table. In reality, countries with universal health care aren't pulling off some magic trick of efficiency. They are simply collecting the money differently through significantly higher taxes. Americans, on the other hand, pay for health care more directly through out-of-pocket costs and insurance premiums. In a column last year, I did the math. Americans spend about 17.8% of GDP on health care, plus 27.7% of GDP in taxes. That's a total of 45.5%. Now compare that to 12 European countries with universal health care. They spend a median of 11.5% of GDP on health care and collect a whopping 41.9% of GDP in taxes. Their total, 53.4%. So in other words, Americans are spending just under 8% less overall on health care and taxes combined. The saving, though, isn't what it appears, because a fair comparison of healthcare costs and taxes needs to account for the fact that universal healthcare systems cover 100% of their populations, while the U.S. system currently leaves about 8% uninsured. If you factor in the cost of covering our uninsured residents, the U.S. likely spends a comparable percentage of income on health care as European countries with universal systems. Our system is far from perfect. As the USA Today article points out, administrative costs are bloated. Harvard's David Cutler estimates that up to 25% of our health spending goes toward paperwork, phone calls, and processing. Price transparency is practically non-existent. The cost of a diagnostic test might vary from $300 to $3,000 depending on where you go. We pay much more for prescription drugs and many procedures than those same treatments cost in other developed nations. And another issue is the fee-for-service model that rewards doctors for ordering more tests and procedures, whether or not patients get better. Now, certainly, we can do better. Innovations like value-based care, where providers are paid for outcomes rather than procedures, could really help shift the system toward real results. Greater price transparency would really empower patients to make informed choices and force the providers to compete, just like we compete on almost everything else on price. And addressing administrative inefficiencies, that could save billions of dollars. Yet fixing the system requires being honest about trade-offs. If we want universal health care at European price rates, we need to accept European tax rates. That's the part of the conversation that gets left out, and it drives me nuts. It's easy to be angry at hospitals, insurance companies, and drug manufacturers. And yes, they all have plenty to answer for, but we also need to face the reality that we've chosen a system that prioritizes lower taxes over centralized healthcare. Anger may have put the flaws in our healthcare system in the spotlight, but finding genuine solutions will require moving beyond expressions of anger and frustration. It's going to demand thoughtful discussions about what kind of healthcare system, as individuals and a nation, that we really want and how we're willing to fund it. Thanks for listening.